Welcome to this video on cystic fibrosis, or mucoviscidosis, designed for pediatric nursing exam preparation. Cystic fibrosis is a life-threatening inherited disorder, damaging the lungs and digestive system. It affects cells producing mucus, sweat, and digestive juices. A defective gene causes these typically thin, slippery secretions to become abnormally sticky and thick, which is a core concept of the disease. Cystic fibrosis is inherited as an autosomal recessive trait, meaning both parents must be carriers. There is a 25% chance per pregnancy for the child to have the disease. The mutation occurs in the CFTR gene on the long arm of chromosome 7. In the pathophysiology, the CFTR gene mutation blocks chloride channels. This leads to the dehydration of extracellular secretions as sodium and water follow chloride back into the cell. Consequently, the mucus becomes thick, viscous, and sticky, plugging various ducts. Cystic fibrosis is a multi-system disease that affects many organs, including the lungs, pancreas, liver, and reproductive system. Comparing healthy lungs to CF lungs, healthy lungs have thin mucus and clear airways. CF lungs, however, accumulate thick, sticky mucus, leading to bacterial colonization, inflammation, and eventual scarring or fibrosis. Let's review 2 rapid-fire questions. Which chromosome is affected? Chromosome 7. What is the mode of inheritance? Autosomal recessive. Early respiratory signs include wheezing and a dry cough. As the disease progresses, children experience dyspnea and obstructive emphysema. Advanced symptoms feature cyanosis, barrel chest due to air trapping, and digital clubbing. Recurrent infections, particularly by Pseudomonas aeruginosa, are common. Digital clubbing is the bulbous enlargement of the ends of the fingers and toes. This is caused by chronic hypoxia. It can be assessed using the Shamroth's window test. Respiratory complications include pneumothorax, caused by the rupture of subpleural blebs, and hemoptysis, which is bleeding from the bronchial arteries. Cor pulmonale, or right-sided heart failure, due to high lung pressure, and nasal polyps are also seen. Meconium ileus is the earliest clinical manifestation of CF in newborns, occurring in 10 to 15% of cases. Thick, putty-like meconium blocks the small intestine. Signs include abdominal distension, vomiting, and failure to pass meconium within 24 to 48 hours. Pancreatic insufficiency results from thick mucus blocking the pancreatic ducts. This prevents digestive enzymes such as lipase, amylase, and protease from reaching the duodenum, severely impairing fat and protein digestion. Due to fat malabsorption, the child develops steatorrhea, fatty, greasy, large volume, foul-smelling, frothy, and floating stools. Rectal prolapse is a frequent complication due to bulky stools and chronic coughing. The earliest clinical manifestation of cystic fibrosis in a newborn is meconium ileus, which occurs in the first 48 hours. Steatorrhea and cough develop later. A key exocrine manifestation is the salty kiss, where parents notice the baby tastes salty. This is due to the defective reabsorption of sodium and chloride in the sweat ducts. This creates a risk of hyponatremic dehydration during fever or hot weather. Despite a voracious appetite, children often experience growth failure due to malabsorption, increased metabolic demand from breathing effort, and chronic infections. Signs include weight loss, muscle wasting, distended abdomen, and short stature. Cystic fibrosis-related diabetes increases with age. Scarring in the pancreas destroys the beta cells in the islets of Langerhans. CFRD has features of both type 1 and type 2 diabetes. Insulin is the primary management. Most males with CF are sterile due to the blockage or absence of the vas deferens. Females have reduced fertility because thick cervical mucus blocks sperm entry, and they face an increased risk of preterm labor. Rapid-fire checkpoint 2. What is the term for fatty, foul-smelling stool? Steatorrhea. Why do CF patients have a barrel chest? Due to air trapping and emphysema. Diagnostic tests include newborn screening for immunoreactive trypsinogen, or IRT, and genetic testing for mutations. Other tests include pulmonary function tests and stool analysis. The gold standard is the sweat chloride test. The sweat chloride test uses pilocarpine iontophoresis to stimulate sweating. A result greater than 60 MEQL confirms the diagnosis. A value between 40 and 60 MEQL is suspicious and requires a repeat test. The gold standard for diagnosing cystic fibrosis is the sweat chloride test. Management requires a multidisciplinary approach. Goals include preventing pulmonary infections, maintaining adequate nutrition and growth, preventing intestinal obstruction and providing psychological support. Airway clearance techniques include chest physiotherapy or CPT, combining postural drainage, percussion, and vibration. CPT should be performed twice daily, before meals or 1 to 2 hours after, to prevent vomiting. High-frequency chest wall oscillation, the VEST, is also used. Respiratory medications are typically given in a specific order. Bronchodilators open airways and should be given before Captain. Mucolytics, like Dornase alpha, thin mucus. Hypertonic saline hydrates mucus. Antibiotics are used to manage infections. The CF diet is high-calorie and high-protein, aiming for 150% of the recommended dietary allowance. Fat intake is unrestricted. Salt supplementation is necessary, especially in hot weather. An increased fluid intake helps to thin secretions. Pancreatic enzymes, such as pancrelipase, replace missing digestive enzymes. They must be taken with every meal and snack. The capsules can be opened and sprinkled on acidic food for infants, but the beads must not be crushed, chewed, or mixed with milk. Fat-soluble vitamins A, D, E, and K are poorly absorbed due to fat malabsorption. Water-miscible forms of these vitamins must be prescribed daily as supplements. Checkpoint 3. When should pancreatic enzymes be given? With meals and snacks. What diet is recommended? High-calorie and high-protein. A parent states they give the pancreatic enzymes with every meal and snack. This indicates understanding of the administration instructions. Children with cystic fibrosis require supplementation of the fat-soluble vitamins A, D, E, and K because the lack of pancreatic lipase prevents fat digestion. A sweat chloride level of 70 MEqL in a child is positive and indicates a confirmed diagnosis of cystic fibrosis. Priority nursing diagnoses include ineffective airway clearance due to thick mucus secretions as the top priority. Other diagnoses include imbalanced nutrition, risk for infection, and activity intolerance. Family education should cover Captain techniques, the importance of adherence to enzyme therapy, infection control practices, and signs of exacerbation. Genetic counseling is also important for planning future pregnancies. Life expectancy has significantly improved, with a median age of 40 to 50 years. New treatments include CFTR modulators, such as Trikafta, which target the protein defect. Lung transplant is the final option for end-stage disease. Here is a revision cheat sheet summarizing the key golden points covered in this video. Thank you for watching. Keep learning and growing. All the best for your exams.